Now, there's a test that is done for the renal arteries. Those are the main arteries of the kidney, and it's a Doppler test. So you are doing this test for the renal artery, and of course, for any artery at all, if you know the primary aim or primary function of an artery, you should know why you are doing the test as related to it. It's mostly due to you are trying to access the blood flow and make sure that blood is still flowing in that artery. So this is a Doppler test. So for renal arteries, why are you doing this? So let's discuss. So it's a non-invasive test. They do it from outside your skin. They don't have to puncture your skin to get any results. So you can see the blue light and the red light. That's trying to show blood flow, you know. So they evaluate blood flow in the renal arteries. And these are the arteries that primarily what will supply the kidneys. So purpose of the renal artery Doppler is what? To dictate if there's a renal artery stenosis. Do you understand? So I'm trying to see if the space in the renal artery is kind of like blocked or reduced in size, you know. They also assess how much blood is passing through the renal artery. So it helps to determine if the hypertension is secondary, okay? And if it is secondary, is it linked to a kidney blood vessel injury or disorder? So you also monitor patients probably after they have done renal stenting or surgeries like angioplasty to remove those things that were reducing the size of the blood vessel. So after you reduce it, you can also be doing this to be following it up, you know. Then how the test works is it uses high frequency sound waves to visualize the renal arteries. So to measure the peak systolic velocity and resistive index, you know. So you can also access the kidney size and the parenchymal blood flow. So advantages is non-invasive. They don't have to pierce your skin for anything. It's relatively safe and inexpensive, you know, and it's useful for screening and also following up someone that you treated. Okay? They can do it by the side, they can do it at the back. Any place that they feel like they can access the kidney better, they can actually do it. So limitation is operator dependent. The results you get depends on how well the operator was trained. Okay, obesity and bowel gas can reduce accuracy. It's less sensitive than CT angiography or MR angiography. So you use it mostly when the patient is young and is having severe hypertension. So you know that in a young patient having hypertension is usually what a secondary cause. So if you are exploring like this, you want to find out what is possibly causing this hypertension. Also, patients that have um, um, hypertension, it was treated, that is coming back. Okay, and also hypertension that has been resistant to a lot of drugs. They are trying to find out, okay, what is the cause now? Then presence of abdominal bloat or unexplained kidney dysfunction. So this is what we have for the Doppler of renal arteries, a Doppler ultrasound of the renal arteries.